Hi, it's Dr. Russ. Today we're here with Orna, who has chronic right sacroiliac pain going on for months, years, a long time. Makes it hard to sleep on the right side. So we're just going to look at it and see what we can see. Ready? Okay, I'm going to lift up your shirt. Tuck it just like that. And let's have a look here. Are these from patches?
Yeah.
Okay, those are not random tattoos. Okay.
Sorry, I couldn't see that.
No, you're good. You're good. Okay. So just generally looking at Orna's lower back, I don't see anything particularly concerning. There's no swelling. There's no redness. Can you reach for the floor? Yeah, just kind of let your head hang. That's pretty good movement through the lumbar spine. And come on back up. And I'm going to ask you to do that again. And as you do, we're going to watch where my fingers are, the PSIS, and we're going to see if they elevate more or less together. And they do. Potentially, there might be, come on back up, a little bit of a lag on that right SI, which would correlate with her feeling stuck in there. We're going to palpate rotation now. So cross your arms in front of you, Orna. And I'm going to palpate across the right SI joint. So my pointer on the sacrum, my middle finger on the ilium, and I'm going to turn her toward and then turn her away. And I want to feel relative movement between my fingers. And as I turn her toward me, it's stuck. It's stuck right there. So as she's turning left, the right sacral base should rotate around to the front. And if it doesn't, then it's stuck in a posterior position. And that's what this feels like to me. Now let's have a look at this other one. So cross your arms, Orna. And I'm going to turn you toward me. And then we're going to turn you away. And on the left side, it feels like it's moving pretty well. Come back to neutral. And we're going to go side to side now. Starting at L5 and S1, I want to feel relative side bending between the segments. Feels pretty good. And when there's a disc stuck or some joint really stuck, it will show up in this side bending palpation. Good. Come on back to neutral. So as she side bends to the right, the spinous processes are both going to be translating to the left, and they should be doing so separating as well, just a little bit on the left side. If we don't feel that, then there's something stuck in there. So what I feel right now so far is that posteriority of the right sacral base. All right. Well, we've got her face down now, and we can do what we do. Start at skin level and gently get her body, her nervous system acclimated to the touch, and while I sort of take a survey of what's going on. So when the patient's laying down, there's no weight bearing through the spine. Anything that's tight or tense is definitely going to be tight or tense when they're standing or sitting. So I feel this right side, this could be the quadratus lumborum. This could be just the erector spinae group, but really from basically the apex of the sacrum right up to the middle thoracic spine is really tight here on the right side. It's interesting that when she was sitting and we did the motion palpation that I wasn't picking up on any joint restriction underneath. That's really actually a good thing, and just something to keep in mind. It doesn't always go together. And so here we're getting into that right SI right here, and that is stuck. So yeah, what I'm feeling is definitely consistent with what you're feeling, Orna. And let's see what the rest of the leg is doing. Would you pick up your feet? Thank you. Okay. So here at the sacral apex, the piriformis is going to attach right there, and the sciatic nerve coming out right underneath it. Is that sensitive? No. Okay, good. So if she had sciatic nerve irritation, that spot would be pretty sensitive. The fact that it's not is a good thing. And we're going to go with that. So let's feel that gluteal attachment from here on the sacrum to here on the ilium. This big arc. And yeah, not too surprisingly right over the SI joint. It's a little thick. It's a little fibrotic maybe, a little bit adhesed. So we'll come back to that. Let's get a sense of this hip joint itself. Okay, so I got my finger tip right on the ball of the ball and socket, and I'm gonna swing it in and out, try and get a sense of it spinning in the socket. And we're gonna give her foot a lift and the knee a little bit of a jiggle here, and see what kind of movement we get in the ilium and in the femur, and that feels pretty good. So there's the sacrum, there's L5, and sure enough, the place that it's stuck is right here, the upper SI joint on the right. So we're going to come back to that. Everything's sort of pointing to that one spot. Thanks. And get a sense of the hamstring, knee. Everything down here seems to be moving really nicely. Good. Nice deep breath here. Nothing quick or sudden is going to happen, just a little bit of a pull. All right, so this brings us to the right SI, the right glute, and again that right thoracolumbar erector. Can we do some cupping to start? Let's start with some cupping. Okay, we're going to do a moving cup, and her skin's nice and warm, and it's got oil on it from the work we just did. So this cup should slide pretty easily. We're going to start here on the gluteal attachment, and yeah, does that feel okay? Not too much?
It's painful, but it's good.
Good pain. Okay. Just keep breathing. We're not going to overwork it. So from the sacral fascia, going in the direction of the fibers, and then going cross fiber on the glute, back and forth. So we're trying to lift the skin and the fascia to create some space in those tissues between the skin and the layer of muscle. And let's get a little bit, there we go. So we got to follow the contour of her back while we use the cup, or we're going to lose our suction. Just like that. You can see there's blood flow moving through here now, much more so than when it was just being rubbed with my hand, because this lift, this suction, is going to create perfusion of the skin and the superficial fascia, and that's where we need to be. Just another few seconds here, Orna. Nice deep breath. Beautiful. Good. Good start. Okay, now let's look at the SI. So I'm just going to get the outline of the anatomy. Tip of the sacrum is here. Inferior to my finger is her coccyx. L5 is right here. So that's the length of the sacrum. On the left side, the apex comes this way, and there's the lower SI joint, and here's the upper. And on the right side, it's much tighter. Here, right here is the lower part of the SI joint, and right here is the upper. So we are going to start by getting some movement of this tissue right here. And we need to remember that, you know, like Einstein said, movement is relative. So it's like, okay, we're going to move it, but move it in relation to what? Move it in which direction? And so moving the skin and the sacral fascia in relation to the sacrum, getting it a stretch in relation to that aspect of it that overlies the glute max. Good. Nice deep breath. Beautiful. We're just going to keep working that because it's releasing slowly right there. So her sacrum is actually kind of not so much a V as like a U shape. I feel that part right there and right on the bone. So bone, soft tissue. And I'm really interested in that interface where the fascia has to navigate overlying soft tissue versus overlying bone. And that sacral fascia is really, really thick. You should look at a picture of it online. It's really thick. It's really regular. It's like straps of collagen, really, really tough, thick fibers. It needs to be because we put a lot of force through our lower back. Okay, so let's lift and jiggle, and we're getting more movement here, which is good. So this next part is going to be a little bit of a traction. So again, nothing sudden, Orna, but you can feel my left hand on your ankle, and we're getting some traction through the whole lower leg as I'm pushing her foot away from the rest of her body and guiding the sacrum and the ilium to go along with it. And anywhere up here on my right hand where I might feel something resisting this movement, I just gently induce the movement that I'm looking for. Now, having just done the traction and the lengthening, we're going to start to induce rotation. So it's a little bit of traction, but it's a little more of a turn out of the heel. And as I do this, the whole right side of the pelvis should, like 2 millimeters, open like a book. And it's a tiny little bit of movement, but it's so important to the whole body that this movement is able to take place. So you can see this is not super forceful. It's literally fingertip. There's really no need to crank on people's lower backs very often. Every once in a while, it can be really helpful to have someone do that, lay on your side, and I'm going to put a big forceful thrust into your lower back. Sometimes that really is necessary, but I think a lot more often this works better. It's safer, and it's safer for my body too. So I've been doing this a really long time, and if I had been doing it that way, I don't think I would still be able to do it at all. So this feels warm. This feels really nice now, and flatter. You know, it just feels a lot less sticky. So in the sake of fairness, we're going to give the left side a little attention as well.